Alright, this is Big Picture Anatomy with a quick look at the joints of the upper limb. Starting proximally, we have the shoulder joint, and yes, our common everyday terms for the joints are fine when they exist. The shoulder joint is between the scapula and the humerus, and it has, as a ball and socket joint, movement in all three planes or degrees of movement. You've got flexion and extension in the sagittal plane, abduction and adduction in the frontal or coronal plane, and then medial and lateral rotation along the axis of the limb. If you want to see more about these movements and see them actually in action, look for my video on joint movements, upper limb joint movements. As we move distally down the limb, we have the elbow, which is between the humerus and both the radius and the ulna. It's a hinge joint, and so we have just flexion and extension. Now, you might think moving distally down the limb that the next joint would be the wrist, but a lot of people are not aware of what we call the radio-ulnar joint between the radius and the ulna. Usually when we don't have a common name for a joint, then we just name it as the two bones that it occurs between, and we actually have two of these, a proximal and distal joint, and these are little pivot joints where the bones rotate along their axis against each other, allowing for, again, it would be medial and lateral rotation along the long axis of the limb, but because it's such a special movement, we call it pronation and supination, because we can do it with our limb in just about any position. This movement, by the way, if you think about it, is as crucial to our ability for manual dexterity as that a famous opposable thumb, because it doesn't do much good to have an opposable thumb if you can't rotate your arm around and lift things up and put them down. So that radio-ulnar joint is one of the key, and its high degree of movement is one of those key features of what it means to be human. As we move distally down the limb, we have the wrist, which is really a whole bunch of little bones sliding against each other in what we call plane joints, like a geometric plane. And so it's really between all of these bones, there's I think about 10 different joints in there, plane joints, and we just lump them all together as the wrist, where the movement is happening between the radius and the ulna, all of the little stone-like carpal bones, and then the first long bones on the palm of your hand, the metacarpals. At the wrist, the sum total of all movements among all these bones is we get flexion and extension, and also abduction and adduction. Continuing distally down the limb, we have between the bone in the base of the palm of your hand, the metacarpal, and the proximal phalanx, we have the metacarpal phalangeal joint. Obviously, between the metacarpals and phalanges, we get flexion and extension there at the base of your digit, and also some abduction and adduction as you spread your digit. The abduction is considered away from the midline of your hand or from the middle digit, and adduction is bringing your fingers back in from being spread back into that middle digit. And these they're basically hinge joints with that little bit of side-to-side movement, and we call them condyloid joints. Finally, the distal-most joints are interphalangeal joints between the phalanges of your digits, and in fact each digit actually has two of these joints. It has a proximal interphalangeal joint, or a PIP, or we call it a PIP joint, and a distal interphalangeal joint, or a DIP, or what we call a dip joint. So we have pips and dips. All these joints is given flexion and extension, and so they're considered hinge joints. So I just want to remind you, you own one of these upper limbs, and you don't necessarily need to memorize all of this. If you know the words for what the words mean for the different kinds of movements, then you can pull out your own arm, isolate that joint, and give it a try and see what kind of movement you get between the bones as you move down the upper limb. So that's a nice look at the joints of the upper limb from Big Picture Anatomy.